Just stand for a second. Let me get the score first. Just stay.
No, I want to see come in.
There's a step.
What's going on?
Tummy pain.
What's your level of pain?
Up to 9.
Whereabouts?
Lower abdomen. In my wrist.
Yeah.
My pelvis is hurting. My arm is hurting. It really hurts.
What sort of pain?
Slicing.
Okay. So what we've done is put 2 pads underneath C7, and the setting on this is sedation on 20, and we're just going to try and calm the whole system down. Is that too much? And we're going to give it 3 minutes. Okay, you're nearly up to 3 minutes with the pads on. What are you feeling?
It's easing. It's not as sharp. I can breathe a bit easier.
Okay, so now run through your pain, please, with a level.
It's gone down to about an 8. It still hurts, but I can just breathe a bit easier. And it's so tense. It's not gone into my back.
The pain or the signal?
The pain.
Okay, lower abdominal pain. Where are you?
It's like a constant cramp. That's about an 8 out of 10. It's just, I just get random shots of jabbing, but the slicing's pretty much not there.
Okay, after 3 minutes, we've changed the setting to relaxation, still on the just below C7, and we'll run that for another 3 minutes, and now I'll start working with the physiokey. So we're going to treat the abdominal area via sujok, right here.
Do you want me to move?
No. Okay, we've had it on for a minute on your hand, on the abdominal area sujok. Tell me about your lower abdominal pain now.
It's decreased
To
a
what?
lot. It's gone down to 6. It's nowhere near as bad as what it was. Sharp pains have gone. There's only a just a low. I don't know. It's just like a light cramp type of pain, but all the sharp pain's gone. It just feels better now.
So what would you give your abdominal pain now?
Out of 6 out of 10.
Yeah.
Okay. So now what I'm going to do is work the abdominal. I'm not going to do lower yet. I'm going to do it in diagnostic. Exactly where I am. It's going to be high frequency to sedate. As you see, her pain's down, but we need to get it down further. Now I can work directly. So I'm just going to use energy level 20, no more, but my hertz is 165. Here we go. You okay with that? 35, 36, last position, 35, and 36 is the one that I green light. If you want to tell us what you're feeling while this is being done. Take it down.
It's nice. Yeah.
So I'm going to go left. I work out which way the body wants me to go with the highest reading, and it's saying go right, and the patient agrees.
It's just relax everything. not can't feel much pain in my tummy anymore. It feels really, really nice.
So the pain in your abdomen now was a 6. What is it now?
Nothing really. Not. Let's just relax everything inside. There's no pain. Can't feel anything. I like that one.
When you're ready? Yeah. Okay, so now tell us, sit up for me. Tell me what you're feeling. So let me just turn the sanakey off for a moment. I'm going to turn that off to tell us what your pain level is.
In my tummy?
Yeah.
I think maybe a 2, but it's, I don't know if that's like just stiffness from not moving all weekend or, but there's nothing.
Okay, pain in your elbow and wrist?
That's very sore. That's about a 7.
Okay, but is the elbow and wrist the only thing that's really sore now?
Yeah, that's it.
All right, so I'm going to continue this treatment up here. That will just be in basic this time. Can you tell me when you can feel it?
Yeah.
Happy?
Yeah,
okay.
That's nice.
So you can lie back and then we're going to start work on the elbow. Okay, you can stop. Now show us where the pain is.
It's all down here, going into my elbow. It's just along there.
Okay, so I'm going to treat here on the reciprocal and I'm going to treat all along there. So where's that? Just tell us what's happening.
On this arm, it's
Can you feel it in your left arm?
Yeah.
Okay, is it too much?
No.
So it's sticky here. And it's low energy. I'm only on about 27. That's okay for you, isn't it?
Yeah.
So I'm just clearing the key point. So tell us what's happening in your left arm.
The pain has the constant pain that was going down that side has decreased a lot. I'd say it's about a 4 out of 10 now. There's still a bit of pain, but it's just decreased really. You know what it feels like? It feels like I've my blood circulation, like do you know what I mean? Like I've got blood flow back in that. It's like waking me up. Yeah. All that pain's gone. No, not got it. I'd give that about a 3. There's just like a little, just a little bit of pain, just kind of like an annoyance.
Are you happy for me to treat directly on there now? Okay. So go. So now what I'm doing is I'm treating directly where the pain is. Same setting as that side, but I'm decreasing the energy by at least half. That's all I need to do. Okay. You alright with that? And I'm just going to find a sticky spot just there. And I get the reaction from the patient. Are you alright? So you can see the whole body relaxing now. Now I'm just putting a little bit of pressure on here where normally wouldn't have been able to touch it. What are you feeling? It's sticky, not that way, but that way. So that's the way I keep working.
Has changed. Oh. It's a bit sore. You know, it's on. It's on here, my wrist bone, and I'm just. I think just going down here, there, gone.
So where's your pain now?
In my wrist bone, and just kind
right there?
And just going up into my pinky finger.
Okay, so we're going to do some diagnostic. And are you okay with that? Is that too much?
No, go, it's okay, go again.
So I'm right on the wrist bone, and I'm just dosing the central point. Are you okay with that? And I'm going to do what we call a small cross.
Oh, that.
That one. You alright?
Oh, yeah. Oh, that's better.
And I'm going to do this point for a minute. Alright with that? Yeah?
Yeah, that's...
Okay, can you pause? On. Okay, so we've just finished treating your wrist. Now I'm going to turn all the devices off and tell me what you're feeling. So let's start at your neck area, shoulder.
I didn't... I've completely forgotten about that. Hey, that's... Yeah, no, there's
Okay.
nothing. It's...
This arm,
It's...
lift it up, move it around.
apart from just, yeah, stiffness, there's nothing.
Okay, let's sit you up. Abdominal pain.
No, there's... just... It feels so much better.
Okay.
Yeah, that's...
So now to finish off the treatment, and even though patient's feeling out of pain, you are out of pain, are you?
Mm-hmm.
Yes. We're going to do a general zone to speed up the body's adaptation response and the self-regulation. So I'm going to go down the spine, and this is going to be in diagnostic, just basic, and I'm going to turn up till you can feel it. Are you happy with that?
Yeah,
okay, so now we're going to go down the spine. I'm just going to take readings. So 49, 67, I'm going to treat this until I get the optimal efficiency treatment, and that's when the green light goes. You're feeling that?
Mm.
63, so now I keep going. 68, I'm looking for 69 or more to treat again, because I always treat with the higher numbers. Nothing, all in the 40s. And I'm going to go all the way down to the natal cleft. As you can see, the numbers aren't as high. So it's this position here that I need to treat. So what I'm going to do is choose harmonization. And I'm going to check the energy level. Can you feel that?
Mm-hmm.
Happy with that?
Yeah.
And we're going to leave that there for 4 minutes. Okay, so we've just done the 3-part down the spine. What are you feeling now?
The no nerve pain, just muscle stiffness, but that's because I've not walked or done anything for like 48 hours.
So you had a lot of trouble getting in here.
Mm.
Can you stand up now and tell us what you're going through, pain-wise, an arm or?
No, there's no pain. I'm able to move.
And just for the benefit of people, you've diagnosed with fibromyalgia.
Yes.
You had a flare-up on the weekend, yes?
Yes, that's correct.
How bad was it? What you couldn't do yesterday?
I couldn't. I couldn't do anything. I couldn't get out of bed by myself. I couldn't get changed. Couldn't go to the bathroom by myself.
Okay.
Couldn't do anything.
Okay. So the wrist pain, which has been bothering, is fine now. You can touch it.
Yeah, I can do. I'm able to move it, which I couldn't do yesterday.
Okay.
God no.
So because of our patient's reactive nervous system, what we're going to do, she has her own sanakey, and we're just going to send her home. She's got an hour and a half drive home.
Yes.
We're going to wire the sympathetic part of the nervous system up. So if you could sit, and I'll show you how we do it. And this is just going to be run in harmonization setting of the sanakey, just for another 20 minutes to half an hour, or as she needs it. So it's just a continued treatment. That's where the highest reading was when I did the spinal. And we're just going to hook this up to the sanakey and send her on a merry way.
Yay!
Okay, done. Okay, so our patient's wired up. Just show us she's ready to go.
Yay! Oh,
Feeling better?
so much better.
And you can walk.
Yep. Oh, and talk. I can. Oh, so much better. Yay!
Welcome back.
Hi.
So it's been 4 days since that treatment. Did you see the footage?
Yes.
And do you remember much about the?
No.
Okay.
All I remember was extreme pain, and that was it.
Okay. So what are you feeling now? Since then, what's happened since then? Can you just give us a little background of the condition, because we didn't have time.
Okay.
What you've been through.
So I've been diagnosed with fibromyalgia.
For how long?
I got diagnosed in 2011.
Yeah.
So 4 years, 4 years. And it was in my lower abdomen to start off with. I couldn't walk. I was in a wheelchair. I couldn't do anything by myself. Had to have somebody just to help me get out of bed, go to the bathroom, shower, anything. And then it went down into my feet, and then eventually it went into my left wrist. And until I saw you, I have been in chronic pain.
Right. Okay. So since over the last 4 days, what have you been through? Since walking out of here, you had the device attached to you, the sanakey.
I've had that attached to me 24/7.
Whereabouts?
I've kept it on my back,
Yeah.
in the position where I left. That has just helped my whole body just relax, just completely relax. And I have had pain, nowhere near as bad as what it was when I came in here. Nowhere near as bad.
Do you remember what level of pain you were? You said 9, but was it more than that? do you think? Or do you remember or totally
Look,
forget?
I can't say exactly because all I remember was just pain. That's all I've got. But yeah, now I'm so much better now.
Great.
I still get bits of pain, but I'm able to manage it. I just grab my device out and just whack it on me. Even if I'm got no idea what I'm doing, I just put it on, let it go, and then it takes just a couple minutes, and I'm already starting to feel pain relief. It's beautiful.
Great.
Sleeping is excellent now. Wasn't able to sleep on the weekend. Had the best couple of nights sleeps last night and the night before, just because I was out of pain.
Good.
It's just brilliant.
Thank you.
No worries.